Today, we're diving into one of the most complex and honestly fascinating healthcare systems anywhere in the world, India's. We're talking about a system that's just massive in scale and importance, so let's get right into it.
Really think about that question. How do you even begin to build a health system for over 1.4 times billion people? It's not just about building hospitals. It's about reaching every single village, every town, and every sprawling megacity. And as you'll see, the answer isn't a single system, but a complex mosaic of many different pieces.
So, here's how we're going to break it down. We'll look at the four main pillars holding everything up. First, the government's public health pyramid. Then, the huge private sector. Third, the nonprofit and NGO networks. And finally, something really unique, the integration of traditional medicine.
All right, let's start with the absolute backbone of it all, the government-run public health system. You can think of it as this giant pyramid, a structure designed to deliver healthcare all the way from the top in New Delhi down to the smallest, most remote village.
Right at the base of that pyramid, at the grassroots level, you've got people like the Anganwadi worker. These are the true frontline workers, focusing on things like child development, nutrition, and basic health for a community of about 1,000 people. For many, they are the very first point of contact with any kind of health service.
And working right there with them is the ASHA, which stands for Accredited Social Health Activist. Now, this is typically a woman from the village itself, and she's been trained to be the essential link, the bridge between her community and the more formal public health system. You really can't overstate how critical her role is.
So you might be asking, how does this all fit together? Well, here's that pyramid structure I mentioned. It all starts at the village level, with the ASHAs and Anganwadi workers. The first formal medical facility is a sub-center, which covers a few thousand people. From there, if you need more help, you get referred up to a primary health center and then to a community health center for more specialized care.
And the scale we're talking about here is just staggering. A single primary health center, or PHC, which is often the first place someone might actually see a doctor, is set up to serve a population of 30,000 people in rural areas, just one of them. And if we go one level up from there, we get to the Community Health Center, or CHC. This serves a huge population, up to 1.2 lakh people. Now, for those of you not familiar, a lakh is 100,000, so we're talking about a facility for up to 120,000 people. This is basically a small hospital, with around 30 beds and specialists in things like surgery, pediatrics, and gynecology.
Okay, but that whole government pyramid, that's only one part of the story. Running right alongside it is a massive and rapidly growing commercial sector, and it plays an absolutely enormous role in India's healthcare landscape.
And this right here tells you a lot. For a long time, public health insurance in India was pretty limited, mostly just for government employees or industrial workers. But in the last couple of decades, private health insurance has just exploded. It's a huge, fast-growing part of the economy now.
And here's the key takeaway. Whether it's a small local doctor's clinic or one of those giant corporate hospital chains, the private sector is where a huge number of people in India actually get their health care. And of course, that means for many, it involves paying out of pocket, and the quality and the cost can vary wildly.
So, let's move on to the third piece of our mosaic. In the gaps between the government system and the private market, you'll find this incredibly vibrant network of voluntary agencies and non-governmental organizations, or NGOs. People often call it the third sector.
And these groups do so much. You might have one that runs a mobile clinic in a hard-to-reach area, another that funds groundbreaking research, or others that are all about creating public awareness campaigns on health issues. They also play a big role in training healthcare workers, basically helping to support the government's efforts.
And just to give you some concrete examples, think about major players like the Indian Red Cross Society. They're indispensable when it comes to disaster relief or running blood banks. And then you have these super focused groups, like the Tuberculosis Association or the Family Planning Association, each one tackling a really specific, really critical health challenge.
This quote here, from the Indian Council for Child Welfare, I think it just perfectly captures the spirit of this whole sector. It's not just about curing a disease, right? It's about this bigger, holistic vision for a community's well-being, especially for the most vulnerable.
Now, working right alongside those agencies are the NGOs. And while they also do things like build clinics and conduct research, one of their most crucial jobs is advocacy. They really act as a voice for the poor and marginalized, fighting for their right to healthcare.
All right, and that brings us to our fourth and final piece of the mosaic, which is perhaps the most uniquely Indian component of all, the formal, recognized system of traditional and alternative medicine.
This whole sector is known by the acronym AYUSH, and that stands for the 5 major traditional systems: Ayurveda, Yoga and Naturopathy, Unani, Siddha, and Homeopathy. And let me be clear, these aren't just fringe practices. They are formally recognized by the government and are being integrated into the national health system.
And the government has some really clear goals for this. They want to mainstream Ayush, which means integrating these practices into public hospitals and clinics. There's a big emphasis on using Ayush for what it's known for, promoting overall health and preventing diseases before they even start.
Take Ayurveda, for example. Its name literally means the science of life. And its philosophy is all about 2 things. Yes, curing diseases, but just as importantly, protecting the health of people who are already healthy. That whole preventative approach is a huge reason why it's being brought into the mainstream.
So, when you put it all together, you can see that the Indian health system isn't just one thing. It really is this incredible, complex mosaic. You've got the government's pyramid, the private market, the nonprofit safety net, and the deep, deep roots of traditional medicine, all working in parallel, sometimes overlapping, sometimes competing.
Which leaves us with this final massive question. In a country that is changing as fast as India, how is this complex mosaic going to evolve? How will these 4 very different pillars learn to work together to meet the challenges of the future and serve over 1 billion people? Well, that's a story that's still being written.